I think you're good to go.
Okie dokie. Thank you. Good afternoon, everyone. Welcome to Women's Voices Raised for Social Justice. We're glad you're all here, and we're really excited about our presentation today called Why Medicaid Matters. I will welcome our speakers. Women's Voices Raised for Social Justice. There's an echo. We're glad you're all here. Don't want to hear myself, okay? As we all know, Medicaid is really a hot political topic, has been for many years, but especially now, and it is extremely critical for people with disabilities. So we want to be sure that we as an organization and you as our members are aware of this very important issue and that we take action. We have as our guests, I'm thrilled to have people who really understand the Medicaid issue and the system and can inform us about what's going on and what we need to do to help. I would first like to welcome Jeanette Mott Oxford. She has been an advocate and organizer on human rights issues since 1983, and she is presently the public policy and advocacy manager at Paraquad, which many of us are familiar with. It is the independent living center for the St. Louis region. Jeanette has many experiences that have made her really an expert in this area, as well as her education, so we're thrilled that she could join us. We also have two Medicaid ambassadors who also bring a wealth of experience and knowledge to our discussion. Everlene Falconer has worked at Paraquad since 2018. She is an employee advocate, a job coach, and a teacher. She currently serves as the continuing education program coordinator, and she has a background in educational science from the University of Missouri St. Louis. She is the proud mother of 3 children and 5 grandchildren, and she's happy. I'm so happy that you're here to share your knowledge with us today. Our second ambassador is Constance Phillips-Gray. She was born and grew up in St. Louis. She's had a fascinating career background as a life insurance agent, a Mary Kay representative, and she operates a family-run cleaning and logistics company. She also has children she's very proud of, and she is a published author. So we're happy to have her join us as well. I will hand it over to the team here to begin their presentation. We ask that if you have questions, you please put them in the chat. And once they've completed their presentation, we will open it up for questions and discussion, and I'll moderate that conversation. I would also ask that you please keep yourself on mute. We are recording this on YouTube, and YouTube has a propensity to pick up noises and focus on them rather than the speaker when it's recording. So if you could do that, that would be very, very helpful. So welcome again, everyone, and I will turn it over to our team to get started. Thank you.
Great, thank you. What we have planned is that Everlene and Constance will each tell a bit about their experience of Medicaid, and then I will talk on the policy angle at the end. We have a philosophy at Paraquad of personally impacted people's stories really mattering. We say nothing about us without us. And so we want to get grounded first in the real stories of people that have had Medicaid assist them with their health issues. So Everlene's going to go first, and then Constance, and then I'll pick it up from there. So take it away, Everlene.
Hi, I'm Everlene, and I am 70 years old. When I was asked to be a Medicaid ambassador and tell my story, I wasn't sure I wanted to do it. I always considered myself private person, but if my story will help someone, I'll tell it. I found a lump in my breast while showering one morning in 2008. My first impulse was to call my children, but I brushed that idea aside because I did not want to alarm them. My doctors worked at SLU, and I knew they had a breast clinic there. So at that time, you could just walk in without an appointment. So I walked in, explained to them what I had found. To tell you the truth, I was scared, but I needed to know. Once I explained why I was there, they had the doctor on duty come and talk to me. She explained to me that she was going to order a mammogram. After the mammogram, they took me upstairs to social services. Once there, the lady I spoke with asked if I was on Medicaid. And I replied, no, just Medicare. She said, that's okay. We'll have you on in 2 days. I remember thinking, that's funny. Usually it takes months to get on Medicaid. So I filled out some papers, and just like that, I was on Medicaid. The next few weeks were filled with doctor appointments. I went in and they did a biopsy of my left breast where the lump was. The doctor was a kind older gentleman who was very understanding. After he did the biopsy, what was once a quarter-sized lump turned into an egg-sized lump. This was because it had developed a hematoma. The biopsy really didn't tell them anything, so they explained to me they had to go in and take the lump out. Now it was time to tell my children that I had to have surgery and why. The day of the surgery came, and my children were there to support me. After surgery, the nurse announced that I was at stage 0 cancer. The doctor came in later and said that it was a malignant tumor inside a blood-filled cyst. He further stated that he had been a doctor for 35 years and he had never seen anything like that before. He recommended that I have radiation treatments. I was later told they wanted to do 33 treatments. Those treatments caused me to have second-degree burns on my breast. Having Medicaid available to me helped in ways no one will ever understand. Without it, I probably would not be around to tell this story. They asked if they could do a case study on me after my treatments. Since SLU was a teaching hospital, I said yes. And I guess without Medicaid, I probably wouldn't be here because I wouldn't have had a way to pay for everything, to do everything. So in that respect, Medicaid really did come to my rescue.
Thanks, Everlene. And Everlene, like many people, did not continue to use Medicaid. You know, we do have an employee health insurance program here at Paraquad. And so often Medicaid is kind of a safety net health insurance program for people that they have temporarily. And I think people don't always understand that part. We're anxious for you to help the public understand Medicaid better, because often it's the myths and stereotypes about Medicaid that feed some of the bad policy ideas that people have. So we'll move on to Constance's story. Constance?
Good afternoon, everyone. My name is Constance. I'll begin with background history on myself. I have been independent financially for many, many years. I held a job since I was 16 years old, had my own place at the age of 19. But it took me several months to apply for Medicaid. I was honestly ashamed that I wasn't able to take care of myself nor my children's healthcare expenses. I've always been blessed to hold health insurance through my employers. In January of 2021, my life changed forever. I was diagnosed with a mental disability. The diagnosis was scary because I had never dealt with anything like this. My grandfather was a double amputee. Both of his legs were removed back in the early 90s. So you could see his disability with the natural eye, but mine was hidden to the naked eye. During the manic state, I quit my job that was paying me over $50,000 plus per year. After my episode, and coming to the realization that I didn't have a job was totally mind blowing. It was it was absolutely crazy to wake up. Like, I had packed up all of my items. I had dropped everything off. This was during the middle of the pandemic. Had dropped all of my items off at work. And I quit. Okay. I just quit the job. And I woke up, I would say probably about a week later, coming out of the medication and all of that stuff. And I was like, I don't have a job. I really do not have a job. It was crazy. So obviously that put me into a depressive state of mind. In April 2021, things were kind of looking back up. I started back working. The job was paying less than what I was making before, but I was happy to just be working again. However, with me working, I was working from home, and it was the worst for me. Working at home, it put me in a very depressive state of mind, because I would literally just get up 5 minutes before I had to be at work and go to the living room and start working. To me, I had no work-life balance with working from home. So I dreaded it. I stuck it out, and I was actually offered another position with a law firm in St. Louis. I began work there, and within 2 weeks, I was fired because they stated that I didn't seem to be a team player. Little did this company know, I was suffering daily just to get out of bed and to shower. So this was the first time in my life where I wasn't financially and mentally sound. I had to lean on family and friends to take care of my basic needs. Prior to my diagnosis, I always made too much money to qualify for any type of financial assistance. So due to the unforeseen circumstance, I was dependent upon Medicaid. I had applied in January and I was approved. And even though like I had those positions, Medicaid didn't cancel me. I still was able to, I was still able to receive my Medicaid benefits, which was awesome. One of my medications is $1,995 for a 30-day supply. So for me, Medicaid is very important because it's either, can I afford my mortgage or do I pay for my medication that keeps me going? So Medicaid is important to keep for myself, for my children. It's a lifeline for me at this point. It really is, until, hopefully one day I'm able to get off of Medicaid again. But if not, I just pray to God that it stays in place. So.
Thanks, Constance. And y'all will have a chance to ask questions of not just me, but of Everlene and Constance after I present a little bit of information about Paraquad, so that you know who we are, why we're here, and how we can be of assistance to you and your neighbors. And then answer a few questions about what's going on with Medicaid at the Family Support Division right now and with our General Assembly. So let me share a few slides with you. So in case you don't know about Paraquad, and many people don't, unfortunately, we're one of Missouri's nearly 24 centers for independent living. We serve St. Louis City and County primarily. We grew out of the independent living movement of the 1960s and 1970s as people with disabilities demanded civil rights. All of us owe so much to the movement for Black civil rights, for an end to structural oppression, like the ways that we denied people the right to vote, to get jobs, et cetera, who were Black. That movement of the 50s, 60s, 70s taught other groups to stand up and to demand that structural oppression ended. And so people with disabilities started to do things like have set-ins in federal buildings. And we were able to secure finally the Americans with Disabilities Act in 1990. But that didn't fix everything, of course. We always say it's more of a floor than a ceiling. It's the least you can do for people with disabilities. You know, should we really have to be grateful all the time that we can find a bathroom that we can use? Shouldn't we just all be guaranteed that buildings don't have barriers for us? So our mission is that we champion equity and independence for people with disabilities through services, partnerships, education, and advocacy. We have 5 core services, which are peer counseling. That's where people are able to get together and share information with each other. For example, we have a spinal cord injury group where people who have spinal cord injuries talk to each other about how they get through life, what doctors have been good for them, what kind of products have been good for them. People that have been through it often are the best advice that you can get. We do advocacy, which is part of what we're doing today, is helping people understand a government program. And sometimes we also advocate for individuals who have faced particular challenges. We do independent living skills training. We believe that a lot of people can live in the community instead of in institutional care when they have disabilities, and we can provide a lot of information about that. We also do information and referral. Folks can call us up and ask questions about, do you know where I can get a wheelchair at an affordable price, that kind of thing. Or do you have programs that train people to work or help people know about workplace accommodations for people with disabilities? We can answer questions like that when people don't know where else to turn. We also have a transitions program that helps people move from the nursing home to the community. And then we also help people that are youths transition to adulthood, because there's a lot of wraparound services for kids that aren't there for adults. We want to prepare people to do well with that. I want to say that we do have a brochure about all of our services that looks like, let me find that for you. Here we go. It looks like this, and I'll put my email address down in the chat box later, so that if you want to learn about all the things we do, you can get a program like this that shows you that we have a culinary program to teach people food safety, knife skills, cooking and baking, customer services. We have employment services that help people know things like, if I take a job, what's this going to do to my Medicaid? Will that amount of income take me off of Medicaid? We have the Stephen A. Orthwein Center, which is a state-of-the-art fitness center. We have a summer work experience program for high school students. There's just a whole lot of things that we do here, and I'll be glad to share that brochure with you if you're interested in learning more about what Paraquad has to offer. So let me go back to my slides real quick here. All right. So one of the things to keep in mind is all of us should be advocating for disability rights. It's in our enlightened self-interest to do so, because disability is an identity group that any of us can join, either temporarily or permanently, sometime in our lives. That can be due to aging, to injury, to illness, to our heredity. I have a particular spine condition that my dad had and his sister had genes will get you, won't they? So I now, am in that group of people with a disability. And so any of us can join that group. We envision an integrated society free of barriers and discrimination, where disability is viewed as a natural part of human diversity. In other words, we reject the medical model. We're not people who are broken and need to be fixed. We're not people who are sick and need to be well. We want people to see us as an identity group, that it's part of the natural diversity of life, is that some of us have disabilities, and our code is nothing about us without us. We believe in self-determination, people with disabilities making the decisions about their own lives, dignity, equity, opportunity, and inclusion. So now when it comes to Medicaid, here's the state of where we are now. And Constance mentioned how for a while there, no matter what happened, she could keep her Medicaid. That's because we were in this public health emergency. And so Missouri was not doing recertifications. You'll see on the graph here, and I got this from the wonderful advocate at Washington University named Tim McBride. Some of you have probably met Tim. We have been having the number of people on Medicaid go up. Part of that's been due to the dynamics of the pandemic, but also because we finally passed Medicaid expansion at the ballot box, as you may recall, and I bet some of you gathered signatures on petitions to make that happen, and bless you if you did, because we had people that were in this glitch where they couldn't get into the Affordable Care Act, and they made too much money to get Medicaid. So over 300,000 Missouri workers were just prevented from getting an affordable health care plan. So during the pandemic, we had Medicaid expansion happen, and we also weren't kicking people off of Medicaid or recertifying people. And then the pandemic ended and something called the unwinding began, meaning the public health, the effects of the public health emergency were ending, and the old rules were coming back into place. And you'll see that quite a few people have dropped off of Medicaid. If you look at who has dropped off, this is who's dropped off. We have about 14% less people with disabilities, 14% less custodial parents, 11% less of the people who are in this. I'm going to have to look up what the AEG stands for. I believe it's an aged is part of the A's, what the A stands for. Pregnant women, 3% loss. Elderly, well, the AEG isn't because there's the elderly. Children, this is the one that we really want to notice. 57% less children on Medicaid. I think this is primarily about that recertification process, because anytime you have to recertify with the federal and state government, you have a lot of documents to produce. You have to do it in a timely manner. People who live in poverty have a lot of challenges to getting their paperwork in a timely manner because they have other problems to solve. Often they have things like utility disconnection notices to solve, eviction notices to solve, and it can make it where you don't get everything in a timely manner and you wind up losing your Medicaid for a while. Often people wind up going back on. We also have people that have been cut off inappropriately. Like we have some folks, I'm going to check in a minute here and see if he's here, because he might tell his story later. We have a gentleman that has a disability and works some, and he was put into a new improved program called the Ticket to Work Health Assurance Program, but they kept putting him on it, taking him off of it, switching him into a spin down category, cutting him off Medicaid entirely. There's just all of these problems that have been happening. So Paraquad, along with the other Centers for Independent Living in Missouri, we call ourselves MOSIL as a group, I had a meeting last Friday with Kim Evans, the head of the Family Support Division, to share these stories about the mistakes that have been happening and the harm that it's doing to people. It's important that we use our statewide network because, there's 163 members in the Missouri House and 34 senators. St. Louis is only 2 counties out of a big state, and we just can't get things done just as a region. We have to depend on the power of having a statewide network. So we met together with Director Evans and we let her know what's going on. And for now, she's set up a problem solver system where there's a particular family support division worker that we reach out to, part of her staff, to try to get these problems fixed, get people recertified and into the right Medicaid program for their particular assets and incomes. And we want to have better than just a problem solver system. We want a systemic fix so that mistakes aren't happening and people are being recertified more easily, is what we'd like to see happen. There are some things going on in the General Assembly right now that could either make Medicaid better or worse. If the federal reimbursement allowance is not renewed, it will take $4 billion of income out of the state budget and throw our budget into crisis. And our state fiscal year begins on July 1. If you don't know what the FRA is, the federal reimbursement allowance, it's a provider tax that like the hospitals and other Medicaid services providers put on themselves in order to put more money into our Medicaid system, because it gives us an advantage in how much we draw down from Washington, D.C. This happened years ago and actually was sponsored by a Republican senator. It's not that this is a partisan issue. The FRA is usually, not that big of a deal and has been recertified in the past, renewed in the past. But right now there's a real struggle going on about it. Senator Bill Eigel from St. Charles County has suggested that he may demand that work hours be documented for some people on Medicaid as a condition for passing the FRA. And there's also Senate Joint Resolution 74 from Jill Carter, who's a Republican from Granby, Missouri. She serves Jasper and Newton counties. And her SJR, which means it would go on the ballot basically to be voted on as a constitutional amendment. It has been voted out of committee, but it hasn't been debated on the floor yet, and the legislative session ends May 17th. So it has little chances of going through on its own in the amount of time that's left. But once something's been heard and voted out of committee, that language can be amended on to other things. So somebody might try to do an amendment to put her language on to this FRA renewal, or it could go on to other bills that open the same section of Missouri code. So we're watching for that carefully. There are a lot of things that need to be solved if we're really going to have a robust and compassionate Medicaid system. Our state workers, you may know, are paid lowest or next to lowest in the nation. Every time that gets measured, that leads to high turnover and a lot of what you would call rookie mistakes, where people that haven't worked for the government very long don't know the rules and wind up getting it wrong. We've had people, when we tell people that this Ticket to Work program passed last year as part of Senate Bill 106, say, oh, that's only in St. Louis City and County. Well, no, it's a statewide law. So some of the Family Support Division workers are getting that wrong. They're saying, no, you don't qualify, because they're going by old rules, not the new rules. Adequate training of the staff hasn't happened. So lots of problems are happening there. The state technology that the Family Support Division uses is outdated. That gets called a legacy system, which is a nice label for computers that, as someone joked once, are only fit to be used as boat anchors, meaning we really ought to just throw all of these out in the lake somewhere, if we weren't worried about pollution, I guess. Some of the state computers don't talk to each other very smoothly. Some of them code things like gender differently than, one program of government codes it one way, another program of government codes it a different way. So we need a real overhaul of our IT in state government. Work hour documentation would lead to inappropriate loss of benefits. The Family Support Division is not prepared to handle a bureaucratic task of that size in an accurate and timely manner. And the claim for why we need work hour documentation is they say that will make it where people have an incentive to work. Really, it's like a punishment if you don't prove that you work. And the proving part is the real hard part, because that documentation, often people really do meet the rules, but they can't prove they're meeting the rules. And the real way to incentivize work is to have reality-based guidelines so we don't punish people for working. Senate Bill 106 last year went a long way in that direction. We used to cut people off of Medicaid at 85% of the federal poverty level. Now you can earn up to 250% of the federal poverty level and then have a slide down, which is a much better way instead of a fall off the cliff kind of system. But that's not being implemented very well right now. So we hope you'll help us change the narrative about Medicaid and tell your neighbors, write letters to the editor, write guest columns for the paper, help get out the word that Medicaid actually is a vital form of health insurance. It saves lives, like Everlene's story. It's there following a life-changing accident or diagnosis, like Constance's story. it helps people with disabilities access the medical specialists they need, like Everlene and Constance's stories, and like my best friend Ann's story. She's had 3 procedures that could not have happened without Medicaid, and I believe I have my best friend today because the Medicaid program is there. So this is how to find me, 314-289-4303, or joxford@paraquad.org. And let's engage with you all about questions that you have. And I'm going to check here and see if, yeah, Ron is on here. Ron, you want to say briefly what happened with you about your Medicaid? Why don't you unmute yourself, and if you're able to put yourself on camera, that'd be great too.
Can you hear me now?
I can hear you, Ron. Yeah.
Okay, good, great. Oh my goodness. With the Medicaid, like Miss Constance, that story is familiar. I take my Medicaid. I'm getting Medicaid through the Ticket to Work program, and like you said, JMO, it's on, off, on, off. It's been done 8 times since April the 1st. I'll look one day and I'm on, and I'll look 2 days later and I'm off. What do they call it? My account shows premium paid for April one day, and the next day it'll show unpaid. What this has done as far as my medications, 3 different insulins I take, and they haven't been able to get them all this month because although my premium's been paid and it shows active some days, but the prescription part shows inactive, inactive. And so I haven't had diabetes medicine all month. Using old insulin, 6 years old. Reusing needles, pen tips. And it seems to me like it's a clerical error or incompetence or something. I'm not sure what's going on.
Yeah.
My Ticket to Work premium has been paid, but I just don't. So it's just back and forth.
Yeah. Yeah.
JMO.
Thank you, Ron, for sharing that. And that's the kind of issue that we brought to Director Evans last Friday and insist that this be fixed. So I have made sure today that Ron knows to reach out to our the person that's over our employment-based programs here, and she'll be going to that problem solver that the state gave us, and we're hoping that we can get Ron's problem fixed and fixed permanently. So it's really important that we do this administrative advocacy.
Absolutely.
And thank you, Wendy, for making sure that I know AEG means Adult Expansion Group. I work to help win that, but I hadn't learned the AEG acronym yet. We have a thing here that says, I have a parent who is disabled with Parkinson's and is insulin dependent diabetic. She is on Medicare and food stamps, which took 4 months. We worked September to get her on Medicaid. The specialty docs have taken her on, but we cannot get her on Medicaid to pay those bills. All right. So are you in the St. Louis area? Are you able to come on and talk to us?
Yes, she is in the St. Louis area. She had moved from Ottumwa, Iowa, to be in St. Louis because of needing family support here in St. Louis. Plus, she's got a 13-year-old daughter.
All right. Well, thank you for sharing that story. And you might want to reach out here to Paraquad and see if one of our benefit specialists can help get that solved. You know, they have offered us this person to reach out to that
Okay.
try to help us with some things. And we're glad to fight for people that are in those kind of situations, because certainly there's disability involved here, and this is our job, is to try to help people continue living in the community or determine what's best for their own lives. So
Thank you.
you bet. Are there other questions or stories that people would like to share?
I had a question, JMO.
Yeah.
I have heard that qualifying for Medicaid can open the door for other services for people with disabilities that they can't access without Medicaid. Is that true? And if so, how exactly does that work?
Jeanette, while you're thinking,
Yeah.
one of the services that people can get is LIHEAP or LIWAP, because, and it makes it much faster to get payment on utility bills, water or sewer, because they are already in the Medicaid system.
Yeah.
And all they've got to do is check the Medicaid information then. That's one of the benefits.
Right, right. So that's one thing, is that advocates have fought for certain populations to be notified of other things. Like that would be, if you're on Medicaid, you should get a notice telling you things like that there's a volunteers and tax assistance program that would help you file your taxes if you can't afford that kind of thing. We want people, like in their paperwork from the state, to be told, here's where you can go to get help on this particular thing. Here's where you can go to get utility assistance. There is a new medical needs, program that tries to offer energy assistance that the Office of Public Counsel has been fighting for, and that Consumer Council of Missouri has been fighting for. So it allows you to find out about some programs. And then being a Medicaid recipient is a prerequisite to get into certain programs. Liz, I think that may be part of what you're indicating.
I think that's what I was
Yeah.
asking.
For example, the Consumer Directed Services Program that provides help with things like toileting, food preparation, transportation in some cases. There are a whole variety of services that you can get through Consumer Directed Services to stay in your home. You can't get Consumer Directed Services unless you're a Medicaid recipient. So Medicaid is the door to get certain things. Everlene, are you familiar with some things that people on Medicaid can get because of you've worked at Paraquad way longer than me, so you may have some good ideas to share with people as well. Oh, you're muted just now. Oh, Everlene, you are still
Are you
muted.
able to unmute, Everlene? Because we can't hear you.
There, whoops. You're screaming. There we
There
go.
we go.
Okay.
Thank you.
At the time that I was diagnosed, I wasn't on Medicaid. I was just on Medicare, but like I said, it was easy to get on because of what I was going through. I wasn't even aware of that until I went to the clinic. But after everything was over with, I was taken off of Medicaid. I was probably on there maybe 6 months after my diagnosis. So I don't know a whole lot about it. I just know it helped me. Because what they found was a malignant tumor. Had it not been in that cyst, it probably would have gotten in other areas of my body. But, it saved me. That's all I can say.
Thank you. We do have some other questions in the chat. James, you want to take
One of the questions is there a bill in Jefferson City that we'd ask you to advocate on? Our Medicaid Ambassador program has grant sources that don't exactly allow me to issue a call to action, but I'm sure that if you join the Missouri Budget Project calls at 3 o'clock on Thursday afternoons, you may hear about situations that you need to intervene on. I did tell you about where a particular bill is, this Senate Joint Resolution 74. Right now, there is no need to advocate on that exactly because it's not in a position to pass. But I did kind of like, give you the information that you need in an educational manner rather than an advocacy manner, to basically say somebody may try to amend that language elsewhere. If you hear that it got amended elsewhere and you care about that, you may want to be an advocate about that, but that has not happened yet. So stay tuned to groups that can issue calls. And in fact, you can certainly reach out to me and become an advocate with us we advocate on a lot of issues. You may, know that we're leading a group called the St. Louis Metropolitan Alliance for Reliable Transit to advocate for Metro to work so that people have transportation to things like their medical appointments. So we do a lot of advocacy where we do kind of like name names and issue calls to action. But I can't exactly do that on this issue, and I don't have anything to really call you to action on because there's not a bill that's poised to pass right now. But watch, because we're near the end of legislative session and bad language can pop up in all kinds of places. The difference between Medicaid and Medicare, someone asked about, both of these are federal programs. Medicare, came into being in the 1960s, right after my grandfather died of cancer. As a poor farmer in rural Southern Illinois, he had no access to affordable health insurance. And I often think, how would his life have been different if Medicare had existed a little bit earlier instead of coming into being basically the year after my grandpa died? He had avoided seeing a doctor because he couldn't. He had a spot on his ear and he couldn't afford to get anything done about it. He just kept painting it with methylate. If anybody remembers what that red stuff, that people used to paint sores with. And it turned out that he had cancer. And if he had an earlier intervention, I wonder if I would have had him longer, but he died at age 69. Medicare is there mainly for older citizens. It's run by the Centers for Medicare and Medicaid Services in Washington, D.C. It has, standards for coverage and may have monthly premiums for medical and drug coverage, deductibles, and you may have to have a supplement in order to get some things covered. Medicaid is a joint program of the federal government and state, and each state, submits a plan that are about its own rules. It's unnecessarily complicated. From my viewpoint, as someone that believes that healthcare ought to be a human right, I'd love to see us have a universal single payer system where everybody's in and nobody is out. And part of the reason I would like to see that happen is right now we spend an incredible amount of our healthcare dollars on determining if a person is eligible. Somewhere around a quarter of all dollars are spent on just figuring out, does this person actually qualify for this service, for this drug? Are they really in this program? That's pretty wasteful, I think. There are many industrial nations that just insure everybody, and I think that would be a better way to do things as a person who advocates for healthcare as a human right. That's my viewpoint on how things ought to be. But right now, Medicaid and Medicare are very important for people to have access to healthcare. And I never believe in ending what's there that's helping some people until you've got something better to offer them. And right now, we don't have something better to offer them. Often Medicaid helps people younger than Medicare can help them.
Jim, I have a question.
Yes.
Are there, because it's differs state by state, are there states that you would say that are exemplars of how they run their Medicaid program that other states could emulate to try to get better services in place? I would not think Missouri is one, but
No.
maybe there are other states that are better at administrating and maybe also giving better benefits. I don't know, but I'd be curious.
Well, there are states that pay their workers better, so they have a more stable workforce. There were times in the last few years when almost half of state positions were vacant, and we've really been having difficulty filling our state worker roles. And so the states that pay their workers better and don't Missouri has kind of attacked worker benefits, downgraded their pensions and some things over the years. It doesn't help us hire and retain a highly professional workforce, and a lot of the mistakes that happen are about the churn, the constant change in who's there. So I would certainly point to some of the states in New England. Sometimes I think it's about the fact that they're a little older than the rest of the United States. And with age, we learn some things, don't we? So, maybe when the rest of the country is as old as New England, we'll do a better job. But often the states in New England or some of the West Coast states do a somewhat better job as well. And I think part of it is your attitude, and that's why I say help us change the narrative about Medicaid. Is unfortunately a lot of elected officials talk about Medicaid as some enemy. When I was a legislator, I served in the Missouri House from 2005 to 2012. This was an age when people remembered a game called Ms. Pac-Man. I don't know if you all remember that, but they would talk about, Medicaid is the icon that's eating up all the state dollars, and therefore we must get people off of Medicaid at all costs somehow. Well, if you get people off of Medicaid, what happens? You have people that are sicker and perhaps transmitting diseases to others that they wouldn't if they were receiving regular health care. You have people with conditions like hypertension or diabetes where more expensive conditions develop if you aren't doing preventive care, if you're not practicing good nutrition, good exercise, taking medicines to maintain your health. You wind up in things like kidney dialysis or amputations, blindness, etc., that will have higher costs for society. So I think it's just really important that we see a need for everyone to be insured. Have the wait times gotten better? The claim is they have, but one of our workers went to a meeting of the Cover Missouri Coalition, and folks from the state were there saying that they'd really reduced their call time. And the person said, "That's not what I'm experiencing." And she dialed it on her phone right then and put a microphone near the phone so that people could hear what was said. And they were told there's like 157 people in the queue ahead of you, which didn't sound like it was a very good situation. Ellen Wentz says, "My daughter had a friend who tried unsuccessfully for 9 months to get on Missouri Medicaid. 2 weeks after she moved to Oregon, she was on Medicaid, and 2 months later she had heart surgery." So again, that's one of those West Coast states that I pointed to that tends to do better. Constance says that she was on hold for how long? 2 hours last week. And that is just wrong. A lot of these changes to how Family Support Services does things happened in 2013. A woman named Allison Campbell was the head of the Family Support Division at that time. And I worked at Empower Missouri then, which is the old Missouri Association for Social Welfare, and they changed their name. And Ms. Campbell came to my office to tell me that lots of things were going to be changing at Family Support Division because they needed a modern business plan. Now, by modern business plan, she meant that they were going to automate a lot of things. They were going to have call centers, maybe in another country where it wasn't the state worker that was taking your call. It was going to be a person working at a call center that had a script. That script might not exactly match your real problem. English might not be their first language, but a lot of things were going to be automated. On this call with Kim Evans last Friday, she told us that they're about ready to do their automated voice recognition program, where AI talks to you, like when you dial in your prescriptions, right? And that's not really a human being engages with you about what you need, and that they're hoping that that's going to help a lot. Well, what really helps people who are in poverty is being able to easily access a live human being that can deal with the complications and people who are poor is real life, So I told her this is going to hurt people. But unfortunately, the state went that way anyway. And I will say it's not exactly Family Support Division's fault. the pressure on in state government is always cut the number of workers. The slogan is work smarter, not harder. And we're going to automate a bunch of things and not need to hire state workers because state workers are expensive. And so it's just been, let's cut the number of workers, let's cut the pay, let's cut the benefits, let's keep the cost of state government down so we don't have to raise your taxes. It's led to just a really hard situation. So it's important that we all be saying that we're not willing to settle for that, and that Family Support Division has an obligation to shape programs in ways that face reality and provide people the easily accessed real human contact that they need. Often with that human contact, people wind up sharing things that they've been ashamed of, like that they're illiterate, or that they are a victim of domestic violence and partner violence, and can then access some other things that they need. Once you actually meet a state worker and get to know them and trust them, it can lead to people sharing their life situation in a way that can make real help happen, because people get connected to services and programs that can help them get to safety, can help them get education, etc. So I think it's important that we go that direction. Are there other questions or comments? Yeah.
I have one further question. I know when you showed us that chart of the cuts, children's services was huge. It was almost as much as the others combined. And I'm wondering if you could speak briefly about the real impact that's had on Missouri's children, and whether or not using that conversation with legislators opens more doors, because people, especially, their hearts often go out to children.
Yeah. As I said, a lot of the reason that the children are falling out of the program is because the recertification process itself is so complicated. The application is long and not easy to read. If the adult falls out of Medicaid, if they're not seeing their doctor, their children may fall out of the program as well, because it's just, there's just too much to handle, and going through the recertification process is time consuming and complicated. And you may not always find somebody down at the Family Support Division that can help you with it right then, because of the understaffing problems that are going on. So the children are the least expensive group to insure, because children as a group tend to have fewer chronic conditions. Many of us develop things like diabetes and hypertension as we age, and as years of poor nutrition can accumulate their toll on us and our particular genes, that kind of thing. So children often don't cost that much to insure. But on the other hand, if you're not practicing preventive care, you can miss a lot of things that need to be found in children, and especially developmental delays. Will kids be found that my parents didn't know I had a vision problem until I got tested for school. So I'd been having my face right down on stuff I was trying to read until I got to school, and they made me go for a test. So you need to find things like language delays, vision problems, different kinds of motor skill delays that could indicate a problem that could be solved with an early intervention. So I think that's the main thing, Liz, is that we may not be intervening as fast as we could, and it can have a lifelong consequence for children.
Thank you.
Everlene and Constance, thank you for being Medicaid ambassadors. Have you thought of anything else you'd like to add that you wish you'd thought to say earlier, or just this conversation with people have reminded you of?
I have a question. This is for Everlene, and you said you were on Medicare, but then Medicaid came in. How did Medicaid cover your bills different than Medicare would have?
I don't know, because at the time I wasn't Well, yes, I was working.
No, I think that was somebody else that mentioned Medicare. Everlene wasn't on Medicare.
Yeah, I was.
They got her on Medicaid.
Well, she said Medicare.
Yeah, I was.
Not in 2008, were you though?
I was working at the hospital at the time, and but I did have Medicare because I was on Social Security.
Hmm. And it's just that the doctors knew enough that more things would be covered under Medicaid.
Yes,
I mean,
yes,
a lot of times they're the only ones that know that stuff.
yes.
So, okay.
Oh, I missed that part. Sorry. I'm glad you
I just,
carefully, Becky.
well, it's such as you have said, and I have said, if we went single payer, we'd spend a lot less time figuring out what we're not going to pay. Because that's that's what all this computer stuff does. And we're just going to pay it. And it's a lot more money going to making people healthier rather than frustrated and denied.
Yeah, yeah. And my best friend, who I said Medicaid had saved her life twice, she's now 68, and so she's on both Medicare and Medicaid, but she can get some things that she needs through Medicaid that she can't get through Medicare. So, often people are dually eligible for both of those programs.
I knew that. Yeah.
And the question about school districts, yes, there are often school districts are a way that kids find out about, and their parents find out about the ability to get kids on Medicaid. But again, school districts are often understaffed and don't have an adequate number of people working in either like school-based social work or nursing staff. So that's one of the challenges as well. The income level for Medicaid is a complicated thing because it depends on which version of Medicaid you go into. Because there's Medicaid for pregnant women, there's age blind and disabled Medicaid. There's the Ticket to Work Health Assurance Program that I mentioned earlier now has better income guidelines. So that's one of the reasons you would contact a place like Paraquad, where our experts on employment and benefit programs know all of the the full set of what's available out there. Kat Lamar is head of those programs here, and we actually answer questions for people in other states as well, due to a particular program that we're the ones that are the experts on that, and so people contact us from a number of places to get answers on that. So Ron, who spoke a little bit earlier, has a part-time job, and he's reached out to us to know how much can he work until he hurts himself by working. And isn't it a shame that we have rules where you can hurt yourself by working? We claim we want people to work, but we don't set the rules in ways that make it possible to work, and that's a real shame.
I would agree. Well, we've reached the 1 o'clock point, and I want to thank you deeply, all of you, for joining us today. This has been a super enlightening discussion, and I know that one of the things Women's Voices does is when we provide education and information, we always want to provide action steps to follow up. And Jeanette, thank you. You've done a great job letting us know that we need to help change the narrative around Medicaid. We need to do things like writing letters to the editor, writing guest columns, communicating to everyone we know the reality and truth about Medicaid and how it saves lives and makes our world better. So I really appreciate Evangeline, Constance, Jeanette. Thank you so much for spending your time with us today. And I hope that Women's Voices can help support the work needed to get Medicare a better system for everyone. So with that, we'll close today. Thanks everyone for attending. We appreciate your being here. I don't know if Laura will come back on, but she's usually handling and closing off.